how to lose fat in the liver is something that scares many people. Here, I will talk about the 15 or fewer signs or symptoms that indicate that a person has this health problem. In addition, I will talk about how to eliminate it, which tests can help determine if there really is fat in the liver, and mention at least 2 actions that I have seen, including on YouTube, that people recommend, and that actually make the situation worse. Some laymen record videos and post them here, which I think is a health risk. Therefore, I decided to record this content very carefully with a lot of research so that you have reliable information for your health issues. It is important to remember that this video has an educational objective so that you have greater knowledge on the subject, but that it is not a substitute for medical care, okay? If you don't know me, my name is Daniel Coriolano. I am a doctor. I did a master's degree and medical residency. And on this YouTube channel, I share knowledge and information about health so that you can have the information and knowledge necessary to make decisions related to your health. But, of course, I do not intend to replace medical care. This is my responsibility, an important statement to start the video. We will talk about everything I mentioned in detail and possibly add some extra information. If you have any questions throughout this presentation, you can leave them in the comments because I can record other videos to answer your questions if they arise. Okay, this is my medical board number, the specialist number. When a doctor does his residency, he becomes a specialist and has 2 numbers, both the CRM and the RQE, which is the Specialist Qualification Registry. I also did a master's degree. Let's continue. This metabolic fatty liver disease, a complicated name that indicates the presence of hepatic steatosis. People who have diabetes, for example, type 2, about 60% of these people have metabolic fatty liver disease. If the person has diabetes and is also obese, at least 80% of these people also have metabolic fatty liver disease, which is the full name for this condition of fat in the liver. Basically, it is a consequence. This video is for you, your family members, or people who think they have fatty liver and want to know more about it. This video is aimed at those who are interested in learning more about health issues and is not academic content, nor is it for my fellow doctors or medical students. I will use terms that are easier to understand here on this YouTube channel, as this is not medical education, but rather health education. In this video, I will talk in more detail about the subject. I will explain what fatty liver is, how to know if you have it, what tests are necessary, the signs and symptoms, and what to do to treat this condition that is a consequence of a set of problems. And what happens if you do nothing? Basically, the signs and symptoms will get worse, okay? That is what you can expect from this video. Of course, as the explanation goes on, new information may emerge. And I will tell you 2 important things, but they are not the main focus of the video. I will tell you more at the end of the video how to eliminate fatty liver. And this works for 60% to 90% of people who follow these guidelines. The success rate is high, and I will also mention what I have seen in YouTube videos that can worsen the situation or even increase the risk of death. This information is important and based on scientific evidence, with references that I can cite at the end. First, it is interesting to understand the function of the liver, because if there is fat, the liver function can be compromised. The liver is the largest solid organ in the human body and performs several functions, such as producing bile for the digestion of fats, metabolizing carbohydrates, proteins, and fats. The liver also acts as a filter, processing medications and hormones, helping to eliminate them when necessary. A healthy liver is crucial for the proper functioning of the body. In addition, the liver stores vitamins such as A, D, and B12, and plays a role in blood clotting. The presence of fat in the liver can be compared to a fever, which is a symptom of infection. Fat in the liver can be a manifestation of problems such as obesity, insulin resistance, type 2 diabetes, dyslipidemia, and uncontrolled high blood pressure. Metabolic fatty liver disease is subdivided into steatosis, when there is only fat accumulation, and steatohepatitis, when there is inflammation, which is a more serious case. If left untreated, it can progress to fibrosis or cirrhosis, which are more serious conditions and indicate permanent damage to the liver. Signs and symptoms of fatty liver include diarrhea, mental confusion, frequent infections, jaundice, yellow skin, nosebleeds or bleeding gums, vomiting blood, and itchy skin. These symptoms occur because the liver is not functioning properly. Ultrasound and blood tests such as aminotransferases, SGOT and SGPT, are necessary to diagnose the condition. If these tests show abnormalities, the doctor may recommend a liver biopsy to assess the extent of liver damage. Treatment includes lifestyle changes such as weight loss, healthy eating, and exercise. Losing 5% to 7% of body weight can improve the condition of the liver. In some cases, medication may be necessary. In extreme cases, bariatric surgery may be an option, especially for patients with morbid obesity. It is important to avoid using teas and natural remedies without medical advice, as they may contain substances that overload the liver. Indiscriminate consumption of teas can worsen liver damage, especially in a liver that is already compromised. If you like the content of this video, subscribe to the channel, share it with your friends and family, and leave your comments and questions. I'm here to help clarify any questions and provide quality information about health. I count on your participation to help the channel grow and to continue bringing you relevant content. Thank you very much for watching, and see you next time.